Steps of insertion. The most preferred site for inserting the pulmonary artery catheter is right IJV, right intrajugular vein. You will establish the central venous access with the 9 French introducer sheath. Then connect the pressure transducer of the distal port of the monitor so that as you advance the pulmonary artery catheter, you can see the waveform as well as the pressure. Keep the balloon in deflated state until you reach the right atrium. You keep a Trendelenburg position to facilitate the passage of pulmonary artery catheter from the right atrium to the right ventricle. Until you reach the right ventricle, you keep a Trendelenburg position, that is head down position. Then you inflate the balloon after 15 to 20 centimeter of PA insertion. That is, once you enter the right atrium, you will inflate the balloon. Once you enter the right ventricle, you give a head up position and a slight lateral tilt to facilitate the passage into the pulmonary artery. Once pulmonary artery tracing is obtained, you advance another 3 to 5 centimeter for the wedging of the pulmonary artery catheter. Deflate the balloon and look for the reappearance of the waveform. Keep the balloon inflated only for brief interval, that too whenever it is necessary. Now, to look into the PA assembly first, here you can see the sheath over the PA catheter. You can see the thermal filament and the distal end will be connected to the pressure monitoring. Up to 40 centimeter, you will move the sheath. Now, sheath is already in the place. You insert up to 20 centimeter. You can see the thermal filament going in. Now, as you enter, this is the RA trace initially. Then you can see the RV trace, which is diastolic is 0. Then as you push in further, you can get the diastolic appearing. This is the PA trace. Then you wedge it. This is a PA trace, proper PA trace. This is the wedge trace. Once you get the wedge trace, after that you deflate the balloon and here you can see the lock is being done so that the catheter migration does not happen. Now coming to the length of insertion. Normally you reach the right atrium at a depth of 20 to 25 centimeter. As the catheter enters the RA, you get a nice CVP tracing. You can see the AC, V wave and the X and the Y descent. As you enter the right ventricle, which is located at a depth of 30 to 35 centimeter, you get a nice systolic waveform and the diastolic is roughly around 0 to 5, which is the right atrial pressure. Then as you enter the PA usually you reach at a depth of 40 to 45 centimeter. Here you get a diastolic waveform. Then at the distance of 45 centimeter, you get the pulmonary capillary wedge tracing where you can get the A and V wave, which is at a slightly higher pressure when compared to the CVP. This is the different length of insertion. Your RA 20 centimeter, RV 30 to 35 centimeter, your pulmonary artery 40 to 45 centimeter and wedge trace at 45 to 50 centimeter. In females, you have to reduce 5 centimeter. If the right ventricle or the pulmonary artery, for example, you are not able to reach the right ventricle at 40 and the pulmonary artery by 60 centimeter, better take out the catheter and reinsert. A few maneuvers which help the pulmonary artery catheter to go into the pulmonary artery are, you ask the patient to hold breath, you give a reverse Trendelenburg or go for a right lateral tilt. If repeated attempts are unsuccessful, always look for abnormal central venous abnormality. Arrhythmias occur when the catheter is in right atrium, but more so in the right ventricle. But this arrhythmias will disappear once you cross the right ventricular outflow tract. This is a supplementary test to confirm that the catheter has gone inside the pulmonary artery. Always avoid excessive coiling. Sometimes you have to stiffen the catheter with cold saline. You inject the cold saline from outside, stiffen the catheter and then forward into the sheath so that it goes into the pulmonary artery. Some textbook says that you give calcium bolus so that the contractility of the ventricle improves, and this increased contractility might push the catheter from the right ventricle into the pulmonary artery.